It was hard accepting that I had a mental illness because in my family, I'm the big, strong guy. Mental health isn't talked about. And when it is talked about, it's talked to hurt somebody. I feel like one of the special things that I've learned is being able to say that I'm a mental health survivor.
How do we demonstrate to young people that they matter, irrespective of what they're doing? You can be exhibiting behaviors that I don't support and that maybe there are consequences for, maybe I can correct, but I still want to demonstrate to you that you matter unconditionally.
The students are with us, their families trust us, and right at that start, you begin to build a relationship. And the impact of those relationships over time are what really matter and what will help to determine the trajectory of a child.
The concept of schools as centers of wellness is meant to suggest that the importance of relationships and support for those relationships, whether it's in the classroom, through the classroom teacher, through social emotional learning, through medical system support in terms of preventive services, crisis services, it all goes together. It all has to be there, and it all has to be on demand, meeting you where you are, not making you go to someplace else to get healed.
So schools have to be a center of wellness because, that's where our kids are. We need to bring the services to them. I know that when I started on the Board of Supervisors, I had a number of principals come to me and say, why don't we offer mental health programs in schools? And as it turned out, and I did the research, we do quite a bit. The problem is we're offering them to schools, but not at schools. And until you offer them at schools where the kids are, it's just as effective as not having any programs at all.
I see my kids here every day struggle with something, right? And whether it's, oh, I'm hungry, I didn't get breakfast this morning, or I saw a violent sort of event. So being able to have somebody on staff right away to address that so that they can continue with their school day and go home and feel safe is probably, selfishly, right, the most important thing I get out of this job, knowing that I get to create safety for children in our community.
Prioritizing wellness, not of just kids, but also of adults, parents, community members, is prioritizing learning. When we prioritize mental health like we have, and wellness, not just mental health, but talking about healthy lifestyles, talking about nutrition, talking about getting enough sleep, things as fundamental as that, you're prioritizing students feeling ready and safe to learn. And so we have seen incredible changes in academic outcomes, not just mental health outcomes as a result of the work.
Kids definitely need school-based mental health because oftentimes it's a barrier for families to be able to get their kids in to see somebody who can be of assistance and help.
Students are just experiencing a lot of stress in their lives, families losing jobs or hours. We have a very high number of students that are unhoused.
They don't have the tools sometimes to be able to relax, to calm, to process. Even when we're getting calls from teachers of this kid is having a lot of behaviors, I need some support. It's just been important to be able to share our calm, not only with the students, but with the teachers as well.
We stand with our community, from the student to the teacher, to the principal, to the superintendent, to the county department of health, to our Medi-Cal partners. We're all working together because we all see the vision, how we can impact the lives of children in Sacramento County.